Welcome everyone. Pain during intimacy is not just physical. It affects emotional well-being and relationships too. So we are talking about right now vaginismus and its treatment by using Botox. So what exactly is vaginismus? Vaginismus is a medical condition where the vaginal muscles involuntarily contract, which leads to pain during sexual intercourse, and even the penetration becomes sometimes impossible. So this medical condition is known as vaginismus. Though physical therapy exists, again counseling exists, but use of Botox or Botulinum Toxin, it's a medical breakthrough for vaginismus. Though this Botox is commonly used to treat wrinkles, but this is effective for vaginismus too. Okay, so let's discuss about the working procedure and effectiveness of this Botox. So vaginal muscles or the pelvic floor muscles. So Botox is used in the form of injection. So first of all, actually, gynecologist or pelvic floor specialist assesses the severity of vaginismus. Then only they prescribe this treatment. So what is done actually, this Botox or the botulinum toxin, this is nothing but a neurotoxin. Okay, this is a neurotoxin which paralyzes the muscles. Okay, and that way the vaginal muscles are relaxed and the sexual intercourse become pain-free. Sexual intercourse becomes pain-free this way because this neurotoxin paralyzes the muscles. So this Botox, this is injected into the vaginal muscles or the pelvic floor muscles, specific area. Okay, and this is done under local or mild anesthesia. And normally the effects begin within days and last around up to 3 to 6 months. Okay, 3 to 6 months. That means this is not a type of permanent cure. This is not a permanent cure. Use of Botox, and I have already mentioned that this is commonly used to treat wrinkles which appear on faces. Anyway, so and one more thing is that this becomes more effective. This treatment becomes more effective when it is combined with a pelvic floor therapy and muscle dilator exercises, muscle dilation exercises. Okay, this works best. This treatment works best. And for many patients, multiple sessions may be required. For many patients, not for all, but for many patients, multiple sessions may be required. Okay, but whatever be the requirement, whatever be the treatment, everything will be decided by your doctor, that is a gynecologist or pelvic floor therapist. Okay, many women suffer from this problem, but they actually cry in silence. Okay, means they suffer in silence. Better to say they suffer in silence. But this is a most common problem in women. Okay, so this is actually involuntary contraction of the vaginal muscles during not only sexual intercourse, during medical examinations of the vaginal area. The patients may feel pain. Again in some cases the penetration becomes impossible due to excessive pain existing in that area. Okay, again in case of tampon insertion, the patients may feel pain. Tampons are used in case of menstrual cycles. Not only sanitary pads, but in some cases women normally use tampons. So during the insertion of tampons, the women may feel pain if those women are already suffering from vaginismus. Okay. Again, in the case of medical examinations, I have already mentioned that thing. Anyway, so this was all about the topic Botox and its effect, whether it is effective or not. So this is effective, but this is not this may be considered as a long-term solution to the problem, but this is not a permanent cure. Anyway, in all the cases, whatever be the case, you should always do all the things under the supervision of a doctor. Okay? Means in consultation with the doctors, in consultation with the gynecologists, they are specialists. Anyway, so this was all about the topic, and this is the end of this video. So thank you for watching this video.